Dr. Chris Baker here. Today I'm thinking about the fears that bind pediatric dentists. Let me tell you a story. I love this story about the guy that was on the roof. There was a flood, and the flood waters rose and rose, and soon they were coming up to the first floor, so he climbed up to his second floor. Then they were coming up to his second floor, and he climbed up to the attic. And then he crawled out the attic window to be on the roof because nobody could rescue him from the attic. He was pretty scared. And here the floodwaters are, rising and rising. Oh, sure enough, here comes a rowboat. All these community people, this one's in a rowboat, and he comes by and he says, hop in, let me get over there. Let me get myself anchored enough. Gotta hop in the boat. No, that's okay, God's gonna save me. And the rowboat guy couldn't talk him into it. So our man on the roof stays on the roof. And then a helicopter comes by, and he calls down to the guy, take the rope, I'm going to lower it down, get in the helicopter, you're going to have to climb up. No, God's going to save me. Couldn't talk him into it. There he sits on the roof. The floodwaters rise and rise, and the man finds himself in heaven. And God says, well, I didn't expect to see you here. And the man said, what do you mean? I was waiting for you to save me. I was calling for you. I said God's going to save me. And God said, what do you mean? I sent you a rowboat. I sent you a helicopter. And you just turned them down. You know, that story is a great one because it reminds us in general of how we often don't even see what appears in our lives to change our lives, to make our lives better, to give us new opportunities. As pediatric dentists, we learn to do restorative. We learn to do treatment plans. We learn about prevention. We can spend a lot of time educating our parents and the patients, mostly the parents, about nutrition, about brushing, about flossing. We can spend tons of time doing that. It's not billable. That's a little bit of a problem. But our hearts are in it, and we're taking care of our patients. And after a while, it gets to be quite a grind. Because guess what? The parents don't change. They say they change. They say they're doing it. But yet you see, they're not. Well, being a pediatric dentist or a dentist who's, let's say a general dentist who loves treating kids, these things can get really tiresome and really hard for us. And then you look around and say, I'm kind of bored here. I don't know what to do. I don't know how to make my practice great. And guess what? God sends the rowboat or the helicopter. We can clear the path for eruption. We can start looking at the potential for ectopic teeth and impactions and huge problems later and start clearing the path. We can learn about that. We can do that. We can learn orthodontics in the developing child. We can change their lives. We can change the class 3 child from looking like a bulldog, as my niece used to say about my little great niece, because she's class 3, or let them look like that. We can help a child have a different life, a much, much better life. There are so many things going on around us if we just avail ourselves of them. But unfortunately, there are fears that bind all of us in the place where we sit. And we tend to say, no, something great is going to come along. It's all going to work out. And instead of noticing these incredible opportunities for us and for our patients and their parents, we pass them by. And God says, I sent you the rowboat. I sent you the helicopter. Let's all look at our pediatric patients a little bit differently. Tomorrow, look at the patient in your chair and think about what opportunities are there. Think about what the needs are that sometimes you wait and assume somebody else will take care of, that you'll refer out later. Think about things that you might be able to provide. Think about airway. Think about eruption. Think about getting a panoramic at the beginning of eruption of permanent teeth and seeing what's going on. Think about learning orthodontics. It's an incredible life with incredible opportunities for you and your patients. Just think about it. Dr. Chris, signing off.